There are times I broke down, I developed hypertension during house job. Doesn't mean it's right, because for the fact that I survived it, doesn't mean it didn't yet kill me. It was so ill to the point that I broke down and I was admission for a couple of times. Do you understand?
Hi guys, welcome back to my channel. Welcome to a new video. I want to say vlog, but this is not a vlog. But today's video is a bit different from what I usually film. I decided to try something new. So in today's video, we're actually having a guest, as you've seen from the intro. And I'm going to try to do more videos like this. I wanted to do a video where I brought a house officer to talk about his whole experience with his house job and what it entails and all of that. So I hope you guys enjoyed this video. I also want to apologize in advance if you notice the audio is a bit weird. I apologize. I thought it would be better than this, but I also didn't want to discard this video. So I really hope you guys enjoy. Please do not forget to like and subscribe, and also share this video with whoever you think is getting it. So yeah, so let's get on to the video. Please can you introduce yourself?
Yes, good afternoon. My name is Dr. Popoolaa.
So you just finished your house job, right?
Yes.
Okay. Could you explain what house job or housemanship is for anyone who's not familiar with it?
Okay, so the word house job, it can be exchanged for housemanship. It's a 1-year compulsory, shall I say, training program for freshly graduated medical doctors in Nigeria, where you go through the 4 core specialties in the hospital: pediatrics, O&G, medicine, and surgery. At the end of the program, you'll be awarded a permanent license to be allowed to practice independently as a medical doctor in Nigeria.
What's the process for getting a place to do your house job like?
So the initial process, number 1, is to graduate medical school. Number 2, to get inducted into the Medical and Dental Council of Nigeria. Then the third is that you should get your provisional license, and there's a folio license or a folio number that MBC usually gives out to individual doctors. So essentially, these are the things that are required. So these are the requirements for house job in Nigeria. Depends on the center you're looking for. The majority of the center is running online. But there is a website, I think the MBC website, where you go and you try and something like a fastest finger. As the center of your choice pops up, you try and click it as fast as you can, because it's very competitive and there are limited slots.
You graduated from Nigerian University, which is our school, and you still decided to come back for your house job. Why is that?
Alright, so the decision of wanting to do my house job, we've heard a lot of stories about house job, house boy work, not doing the core medicine, not doing the core profession. So I needed that hands-on, especially doing it in a place where you did medical school. You just simply continue going management with your lecturers and the consultants. So you are familiar with the environment, you are familiar with the teachings, you are familiar with everything.
So for somebody who is looking for a place to do their house job, what would you say they should look out for?
It depends on, there are various factors to the things. It depends on, number 1, your preference, and number 2, what you want to use your life to do, essentially. Time, money, considering toxicity, considering if you want to practice or not. So in terms of time, do you want to do other things outside of medicine? Apart from outside of medicine, other things outside of housemanship. For example, you still want to, write international exams for medicine, but outside of housemanship. So if that's your life goal, I think you should do it in a center that is more chilled than a center that has a lot of work. And it also depends on if you want to practice or not. For example, I want to practice medicine, so I chose a center that had hands-on. But it differs per center. If the center is toxic, questions. Yeah, ask questions. There are people that have gone ahead.
Yeah.
They will tell you, but just ask only one person. Because what if it's that person that was actually toxic and they were just the mirror reflecting? Do you understand? Ask a lot of questions.
So a lot of people say that medical school is not as stressful as doing your house job, and that when you start your house job, that's where the real stress starts. Would you say that that has been true for you?
I don't like to look at life like that from that perspective. I like to compartmentalize life. Each stage that you are in has its own struggle, and I would advise that you should bask in that stage. Do you understand? Because there are so many factors to the word stress. Number one, the phase you are in. Number two, the person you are in that phase. Who you were in medical school is not the same as who you are right now. You could be better, you could be worse, you could be anything. Life circumstances might teach you so much. The responsibilities that you had there then may be either more or less. So I wouldn't compare medical school and housemanship. Medical school had its own struggle. When every house officer was a medical student, we struggled with one thing or the other. So I don't see the need for, shall I say, beating down struggles of medical students, telling them you're not seeing anything yet. You were once there, you won't struggle with it. So allow them to enjoy the struggle. So essentially, that's my own take on it.
Could you describe what a typical week looked like for you during your house job?
Alright, I like the angle of week because you can't describe a typical day because a typical day encompasses a lot of things. Number one, if you're on call the previous day, if you're on call 2 days prior, if you're on call next 2 days, do you understand? So there are a lot of things, there are a lot of factors that contribute to a typical day during house job. Monday, I clock in work 7:30 a.m. We go for morning meeting where a lot of things happen. Yes. So we go for morning meeting to start internal medicine ward rounds. The single patient can take 40 minutes and you have 40 patients or more. So that goes on till 4 p.m. 4 p.m. we go to accident and emergency. In this place, the first on call is usually the house officer or the medical officer, depending on that particular call roster. So the house officer, the first on call, there is no first on call surgical. No, if you are a house officer in the accident and emergency, you see all the patients. Then you are also on call in the wards, multiple emergencies. You do like that 8 a.m. Actually 7:30 a.m. Then you go for the next day 7:30 a.m. the next day from 7:30 previous day to the next day 7:30 a.m. You go for morning meeting. Sometimes many times you don't rush, you won't eat, you go, you present, then afterwards ward rounds the next day. You continue like that till 4 p.m. Then you go home, try and catch the sleep and eat before the time. 4 p.m. is theoretical. Sometimes we leave here 5, sometimes 6 p.m. We come to work the next day 7:30 a.m. 7:30 a.m. You clock in morning meeting. That day you be on call. So rinse repeat. And as a house officer, you come to work 7 times a week, essentially every day of the week, and you do ward rounds. So essentially, what you did on Friday, even if you are not on call on Saturday, you still come to work on Saturday and do ward rounds. And essentially, it's the same ward rounds you did on Friday. So essentially, it's still the same work. You understand? So you do the same on Sunday. And mind you, that if you are on call on Saturday in the accident and emergency, you must somehow mix this call with ward rounds. So how you want to do it? I don't know. If you want to do it before or after, do that 3 times a week. That's 36 hours straight, 3 times a week, every day of the week.
That's a lot of work.
Yeah, it is. It doesn't mean it's right, because for the fact that I survived it doesn't mean it didn't nearly kill me. Because there are times I broke down, I developed hypertension during house job. So doesn't make it right.
We're doing pediatrics posting that time. And I remember I was with one of the residents. She was on call that day. And it was in the day that time. We were looking for house officers. They're like, oh, this house officer is not feeling well. This house officer is sick. This house officer, we got like 4 houses. They're like, oh, why the they're like, they're all not feeling well. And so because of that, they could not, come to work that day. And so it was just 2 residents, 8 of them. And then they still needed them to attend the meeting. So imagine if they have gone for the meeting. So nobody will have been able to attend to patients that day. So like that's how bad the healthcare system is. But
The problem with this system is that if someone breaks down, the workload is transferred upon the remaining, then the remaining will not break down. Then the ones that are just recovering from the breakdown, the workload is transferred to them, then they break down.
with the workload you had as a house officer, was there still time for you to study?
Well, the studying in Housejob is actually studying never ends, but it changes with time. For example, a house officer or a doctor, I would say the reading of a doctor is quite different from that of a medical student. Because sometimes you won't have sufficient time to sit down and be reading. So what you can do is to be glancing through. Do you understand? Per time, for example, per patient. Sometimes when we stand up to, I want to use the restroom. There's a case that is, letting your head turn upside down. You just go and check it quickly. But now you must have a base knowledge. You must have put in the work in medical school, such that when you are checking those things, it's just as if you are just relaxed. The way I'm going to read a topic, I can read it under 2 minutes. Then it takes you 30 minutes. And that's because I've once read it for 30 minutes. I don't know if you understand. So yeah, it depends on how much work you put in the school.
What were some of your best and worst experiences during Housejob?
Well, I have a lot of good experiences actually, and a lot of very bad experiences. Yes, so for the good experiences, generally speaking, that's why I said from the beginning, where I did my Housejob, I did 7 cesarean sections as they did surgeon from start to finish. I did a lot of things, but those are good things, those are good times, you understand, and it exposes you to a lot. So I have a lot also. A lot of not so good experiences. There are some I can't say on camera, but essentially I wasn't feeling well for a while, and the way it was handled, but I got to realize that it wasn't the management that was responsible for that. It was the people that I was working with. You understand? I was so ill to the point that I broke down and I was admission for a couple of times. Do you understand?
During your Housejob experience, was there ever a time you were managing a patient and you were like, I'm actually a good doctor?
Yeah, that happened in the beginning. Okay. Where you be first very excited and you're calling you doctor, this doctor, that gets imitated by. Because once you get doctor's work, when I was doing my pediatric posting, my first 2 weeks I made some diagnosis that the department had to look at me like, no, this is good enough. You understand, diagnosis like Kawasaki disease, scarlet fever, the things that were not so common, you understand. So that made me feel good. You understand? Yes. So
if you were to advise a medical student in their final year, what would you say they should work on in order to prepare for their Housejob?
Understand what you are doing. Do you understand? Understand. Number 2 is that 2 things make an excellent doctor. It's not the ability to make a diagnosis that make you an excellent doctor. As a house officer, the ability to convey the situation in its matter of urgency, seriousness, to a person that can make the diagnosis. That's what makes you an excellent house officer or an excellent doctor. The ability to extract history, not just constellation of clinical features. History, sometimes the diagnosis is not in the clinical features. The diagnosis is the history. Ask the person what happened, when did it happen. For example, an unconscious person, they won't be able to tell you anything. But people around, if you take that's now history, what is the event?
I hated history taken as a medical student. I hated it. You understand? So, but when I began to practice, I now came to the understanding that It's very important. Not just constellating signs and symptoms. I think in Canada. This related.
How would you advise a new house officer to get the best of the house job experience?
Essentially, it's the same thing. Just like that yourself. Just be reliable. There's something about being a reliable person, or being a reliable doctor. Now they don't just, see your name as who left this patient or who made this assessment, Doctor. You are not just a bloody house officer. You are more than that. The greatest preparation you can have going into house job is mindset. Be confident.
So, what was your favorite posting during your house job?
Favorite posting is actually ONG. So I like the structure and the consultants are always available. From hating ONG to having not so much hate for ONG again. The patient comes, bleeding, blah 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 blah. You carry enter theater, you stop the bleeding, bring out the baby, mother is fine, baby is fine. In the next 3 days, they are going home. Internal medicine, you can see a patient for 1 month, and the patient is still there.
My next favorite is pediatrics because of the people that I worked with, the consultants that I worked with. Very nice, very approachable. Visited Dr. Ikeke, Professor Jimo, a lot of them. Dr. Courage was one with me in the she guided me. She was patient. Because I asked a lot of questions I would ask, and she was ready to answer me. So these things were actually, my worst was internal medicine. I don't want to go there. But that was my best course in medical school because I had a lot of internal medicine stuff. But I don't know, the stuff doesn't translate to the patient well.
And for the final question, what advice do you have for a medical student who feels they don't know enough to become a doctor?
One of the best quotes I've heard in this medical line was given by one of my classmates when he was finishing medical school. He said something that you should relax. Medicine has been forming in you all this while. You will be surprised. Every little effort, every single thing you have done is contributing to building something inside of you. That is medicine.
So that's the end of the video. Do you have any social media handle?
One is on YouTube, Understanding Medicine. Still on TikTok, Understanding Medicine. Also on TikTok, I have Popoolaa, Popoolaavanil. Same goes for Twitter and Instagram. Instagram, I have both the Understanding Medicine and the Popoolaa essentially. So thank you so much for watching the video. Please like and subscribe and tune in for more educating and entertaining content. Thank you very much.
See you guys in another video.